Hello, it's Dr. Tugbiyele here, the online Urogyn doctor. So for those of you who are meeting me for the first time, I am a board-certified urogynecologist, meaning I educate and take care of women just like you who have problems with their pelvic floor function. So essentially bladder function, bowel function, sexual health and function, and pelvic floor health. And so many women do have problems with their pelvic floor, and they are too embarrassed to talk about it. They feel like they're the only ones who are experiencing. They have to live or put up with it. And you may be a woman listening to me right now who has an issue with urinary leakage or bladder leakage. However, what I want to do is encourage you that you don't have to feel embarrassed. You're not alone. Many women experience this. That you've been perhaps putting up with it, but you don't have to. There are actually many safe and effective options out there that are available that can improve your quality of life and keep this from getting worse. And so while I know it's not been easy to talk about, I actually want to help you. So how about we just talk about it, okay? So in my previous videos, I talked about stress urinary incontinence, which is leakage with laugh, cough, and sneeze, lift, bend over, exercise, and even with sex. I talked about pelvic floor exercises, how that can be helpful, seeing a pelvic floor physical therapist, that's another option, or being fitted with a pessary device vaginally, which can also help improve on the urine leakage. And now many women do notice a significant improvement in their bladder leakage with one of those options. However, there just happens to be a significant amount of women who also do not notice an improvement with their leakage with any of those options, making surgery the next best option for them. Now, if I have to be truly honest, even as an experienced surgeon, no one truly wants surgery, right? And I understand that. However, it just so happens that surgery can end up being the next best, the only step left for women who have not noticed an improvement with those other options. And so if you're a woman listening to me today and this has been your experience, let's talk about some of these surgeries that are available that can help you. Okay. So just one of these surgeries is something called a Ure Injection procedure. And these are procedures that are done, can actually be done under sedation. They involve injecting like a natural product. It can be collagen, it could be a gel into the urethra while a woman's asleep. And that can help to support the urethra in the sense that it helps the urethra seal better and to help to prevent the leakage. A lot of women deem this or consider this like a natural option, and women who are young, for example, in between having children, women who have very mild leakage, and those previous options that I mentioned are not helpful. Yeah, this is a good option for them. Another option that can be helpful is what we call a bladder neck suspension procedure. And with this type of procedure, this is done under anesthesia typically, and it involves placing sutures on either side of the neck of the bladder, meaning the place where the bladder and the urethra meet, that area is called the neck, and it involves placing sutures on either side of the neck of the bladder from the inside of a woman's body. This procedure used to be done through an abdominal incision, but now actually it can be done through it can be done laparoscopically or robotically, so through tiny holes. So it's minimally invasive, causes very little pain, bleeding, scarring, infection risks are much less with a minimally invasive laparoscopic procedure, and it can be helpful. And women go home typically the same day. Okay, and so it's using a woman's own tissues and sutures to support the neck of the bladder. Then the other option is what we call a bladder neck or pubovaginal sling procedure, and that's another way of supporting the neck of the bladder, but rather than using sutures, it's we use a piece of fascia, your own fascia, and we get this fascia from either your abdomen or from the thigh, the side of the thigh, and that can help to support the neck of the bladder and provide and help with the leakage. And then lastly, there's a procedure called a mid-urethral sling procedure, and that is another way of supporting the tissues. However, this is a procedure that's placed at the level of the urethra, not so much the neck of the bladder, but lower down on the urethra. It's and it's done vaginally under general anesthesia, typically a light form of that, or sedation. Women go home the same day. Takes about 30 minutes or less. This is rather than using a woman's tissues, this is where a mesh product is brought in, and it's kind of in the shape of a ribbon, and that is placed underneath the urethra. It encircles the urethra and helps to support like a swing. And so that's another procedure that can be helpful, typically reserved for women who have completed having children. It's very effective and it works well, and women go home the same day, as I mentioned. And so these are kind of examples of the procedures that can help support the urethra and or bladder neck and help women who have this condition. Now, there are general pros and cons to each of those procedures. With the injection procedure, a lot of women will notice an improvement, but it may not last a long time in all women, maybe several months and maybe several years, but some women may find that it has to be redone again. With the suspension procedure using sutures, that can be helpful, but a percentage of women, as they get older, may notice the leakage get worse and they have to then have it done again, or have another procedure done, I should say. Then lastly, the bladder neck procedure using tissues can help to support a woman's urethra. But again, with a woman aging, she may notice that her leakage is coming back. And lastly, with the sling, it works very, very well, but we have to be mindful of making sure that it's done in a way to minimize any issues with healing related to mesh. Now, I mentioned a mesh procedure. Mesh, it's not the same meshes that women may have heard about that has caused that they feel, oh, wow, is that what I heard about? That the issues with mesh? No. That mesh issue came about with women who are having a mesh placed for prolapse vaginally, which in what we're talking about is a mesh sling that's used for incontinence. So when it's done in the right setting for the right reasons by the right specialist and the right patient, that procedure can actually be very helpful. Okay, and of course, I just kind of talked general about these risks and benefits. It is important to discuss this thoroughly, your specific situation with your surgeon, and weigh and discuss, your options, because there are many factors involved, and seeing an experienced board-certified urogynecologist is actually very, very key in making sure you're getting the best counseling and making sure that you are getting to be able to make the best decision. In terms of healing times, it can go from days, a few days, depending on the procedure, like the injection procedure, to a few short weeks with the sling procedure. And in terms of recuperation, usually within, again, a few days to 1 to 2 weeks, a lot of women are able to return back to work or their usual activities. But for a sling procedure, for example, or a bladder neck suspension procedure, it may take anywhere from 4 to 6 weeks before women are able to resume their usual activities and strenuous activities, so to speak. And so I kind of spoke generally about these procedures. Again, talking to your surgeon is very key to discussing your specific situation. And so I truly hope that this video has helped you, encouraged you that there is hope and you don't have to live and put up with this condition or unwanted bladder leakage. I have created a bladder health guide that I'd like to actually share with you. It is a guide and actually answers the top most common 5 embarrassing questions that you've been too afraid to ask or too embarrassed to ask. And I created this guide because, of course, I've cared for thousands of women and educated thousands of women over the years, and these are the questions that keep coming up time and time again. And so I thought I'd be able to help you and share this with you. And so if you click the link in my bio, you'll be able to have that sent to you, and I'd like to just share with you. Okay. And so, again, I'm an experienced urogynecologist, 20 years. I've cared for thousands of women who have this condition safely, confidently. And so, definitely, it's important to see someone who you trust and can talk to you about your options and your specific situation so that you can pick the best decision to take care of your body and improve your quality of life. So that